Now, mu receptors are also naturally stimulated by, there is something called as chemicals called endorphins and enkephalins. See, they are not going to act on a peripheral level. They are centrally acting analgesic, right? See, peripheral analgesic, what do? They are antiprostaglandins, let's say. Which were what? Antiprostaglandins were anti-inflammatory drug. Let's say, for example, this is what is your hand. Here the pain is there. Ultimately, pain is perceived where? In the brain. Right? So, either you kill the pain here or you kill the pain in the brain level. So, killing the pain at the local level is by reducing the prostaglandins, because prostaglandins are the mediators of the pain. Right? Anywhere there is a swelling, anywhere there is a pain, or anywhere there is a fever, which chemical is there locally? It's a prostaglandin. So pharmacologically, if you reduce prostaglandin, you're going to reduce pain, reduce fever, reduce swelling. So those are the NSAIDs, non-steroidal anti-inflammatory drugs. It's as simple as that. But they are peripherally acting. But ultimately, this pain is perceived where? In the brain. For example, if somebody has a fracture, does the patient feel fracture pain in a sleep? Deep sleep, for example? No, he doesn't feel, even if the fracture is there, because the pain sensation is cut off. So we are also able to cut off that pain sensation by giving certain drugs, which are ultimately cutting off the pain sensation by stimulating the mu receptors, which are opioid analgesics like morphine, noscapine. Mu, the types of receptors आहेत सगळे, mu1 to mu6 receptors and delta and kappa, ते सगळे types of receptors आहेत वेगळे. हे because opioid analgesic there are a number of drugs, so few drugs are going to act from mu receptors, few drugs are going to act from delta kappa receptors. त्याचं काय जाऊन दे, बेसिक मेकॅनिझम ही आहे की त्याचं क्लासिफिकेशन लक्षात घे, कसे ते काम करतात ते लक्षात घे, त्यांची युजेस लक्षात घे. बिकॉज मॅक्सिमम इट कॅन कम अप ॲज अ शॉर्ट नोट. आय कॅन से morphine can come as a short note. Oh, heroin can come. Heroin is already banned, but heroin was also a drug which was an analgesic drug, I can say. But it was already banned. But we have the other drug like, for example, pentazocine, which is being used by anesthesia, like your Fortwin, which is a brand name. Pentazocine is a morphine type of drug. Dextromethorphan is a morphine type of drug. So that classification you remember, mechanism you remember, and different drugs with different uses you can remember. Toxicity, morphine is also a drug which can be dependent on, because what exactly happens is it also elevates the mood. And something is going to elevate the mood.